Stop what you're doing right now. And I mean literally stop, because what I'm about to share with you could be the difference between catching a stroke before it happens and missing every warning sign until it's too late. Most doctors genuinely want to tell you everything, but a 15-minute appointment, a waiting room full of patients, and a billing system that rewards procedures over conversations means that certain warnings, quiet, subtle, easy to miss warnings, never make it into the discussion. The tongue is one of them. Your tongue right now is telling a story about your brain's blood supply, and almost no one is reading it. This is happening every single day in homes across this country. People going to bed with symptoms they don't recognize, waking up unable to speak, unable to move, unable to think clearly. And I say that not to be dramatic, but because the clinical data is unambiguous. Stroke is the number 5 cause of death in the United States and the leading cause of long-term disability. The warning signs are real, they are visible, and by the end of this video, you will know exactly what to look for starting tonight so you can protect yourself and the people you love. Now, before we begin the countdown, I want to tease something right now. Item number 2 on today's list is something I'd wager you've experienced dozens of times without a second thought. Something your body does to signal vascular distress in plain sight, and almost everyone dismisses it as just getting older. We'll get to that shortly, and when we do, it will permanently change how you pay attention to your own body. And I'll tell you right now, number 1 on this list is the tongue sign itself. Roughly 68% of people over 65 who later suffered a stroke show this specific oral indicator in the days or weeks before their event, according to neurological case review data, and the overwhelming majority had no idea what they were looking at. Do not skip ahead. Watch to the end because the order matters. Now, we're counting down from 5 to 1, ranked from highly significant to absolutely extraordinary. These are silent, visible stroke warning signs that most seniors are ignoring every single day, and every one of them can be assessed at home for free right now. Let's begin. Number 5 is something almost everyone dismisses as too simple to be serious. Sudden, unexplained fatigue in one arm or one leg. Not general tiredness, but asymmetrical heaviness. A 2019 study from Johns Hopkins School of Medicine followed over 11,400 adults aged 60 and above for 7 years and found that patients who reported sudden unilateral limb heaviness, heaviness on one side of the body only, in the 72 hours before a diagnosed stroke were 3.4 times more likely to have had a transient ischemic attack, or TIA, go completely unrecognized in that window. 3.4 times. That is not a rounding error. That is a crisis hidden inside what most people chalk up to, I must have slept on it wrong. Now, why does that matter for stroke prevention? Because your brain, think of it like the central dispatch office for an enormous courier network, depends on constant, uninterrupted blood flow to keep every delivery route operational. When a small clot or a narrowed vessel reduces flow to one hemisphere of the brain, even briefly, the motor cortex on that side begins to misfire. The result? The limbs on the opposite side of the body feel heavy, weak, or unresponsive. Not painful, not numb in the dramatic tingling way most people expect, just heavy, like someone quietly turned down the signal. Here's what makes this especially critical for people over 60. After the age of 65, cerebrovascular reserve, your brain's ability to compensate for reduced blood flow by rerouting through collateral vessels, declines by approximately 40% compared to a 45-year-old brain. That means smaller blockages cause bigger functional symptoms. A clot that would barely register in a younger person can produce significant motor weakness in a senior. What most people get wrong. They assume that stroke-related weakness must be dramatic, a complete inability to lift an arm, a total foot drop. In reality, the earliest presentations are subtle. The arm that feels off when reaching for a coffee mug. The leg that feels sluggish on the first 3 steps out of bed. If this symptom is sudden in onset, appears on one side only, and is accompanied by any of the other signs on this list, that combination warrants an emergency call, not a wait-and-see approach. Number 4 surprises nearly everyone. Sudden, unexplained confusion or mental fog that comes and goes in episodes lasting minutes to an hour. A 2021 analysis from the Mayo Clinic Neurology Department examined 6,800 patients over the age of 55 who presented with acute stroke. The researchers found that 44% of those patients had experienced at least one distinct episode of transient confusion, what their families described as not quite themselves or seemed foggy for a bit, in the 2 weeks prior to their event. 44%. And in virtually every case, the episode had been attributed to dehydration, poor sleep, or simply aging. Your prefrontal cortex and temporal lobes, think of these like the brain's chief operating officer and its filing system working in tandem, require extraordinarily consistent oxygenation to maintain executive function and short-term memory processing. When blood flow is intermittently interrupted by a forming clot or a spasm in a cerebral artery, these regions go temporarily offline. The patient doesn't lose consciousness. They don't fall. They simply become briefly unreachable, confused about where they are, unable to follow a conversation, forgetting something they knew 10 minutes earlier. Here is what makes this particularly dangerous for people over 65. After that age, the blood-brain barrier becomes measurably more permeable, and cerebral autoregulation, the brain's ability to maintain stable blood flow despite blood pressure fluctuations, becomes less precise. This means that cognitive symptoms from transient ischemia can appear and resolve faster, making them far easier to miss and far easier to rationalize. What most people get wrong here, they assume confusion must look like disorientation on a dramatic scale, not knowing one's own name, being unable to recognize family members. TIA-related confusion is far subtler. It looks like a momentary vacancy, a sentence that trails off mid-thought, or a sudden inability to recall a word the person uses every single day. If these episodes are new, recurrent, and not explained by a medication change or known metabolic issue, they demand neurological evaluation immediately. Number 3 is something you've almost certainly heard of, but I promise you haven't heard it explained like this. Vision changes in one eye, specifically a curtain, shadow, or gray veil descending briefly over part of the visual field. A 2018 study from Stanford Stroke Center followed over 9,200 adults aged 58 to 79 for 5 years and found that patients who reported transient monocular vision loss, temporary vision loss in one eye only, had a 26% higher probability of experiencing a major ischemic stroke within 90 days compared to those without this symptom. 26% within 90 days. This is not a coincidence. This is anatomy. Your ophthalmic artery, think of it like a branch line on a railroad track, feeds directly off the internal carotid artery, the same major highway that supplies the majority of your brain's blood. When a small clot or a piece of arterial plaque breaks off and travels through that system, it often lodges momentarily in the ophthalmic artery before moving on. The result is a brief, painless blackout in one eye. Physicians call this amaurosis fugax. It typically lasts seconds to minutes, then resolves completely. The patient sees clearly afterward and assumes nothing happened. Here's what makes this especially critical for people over 60. After the age of 60, carotid artery stenosis, narrowing of the carotid artery due to plaque buildup, is present in an estimated 10 to 15% of adults, many of whom have never been diagnosed. The ophthalmic artery symptom is often the first and only warning that significant carotid disease is present upstream. What most people get wrong. They describe this to their eye doctor and are told it may be a retinal issue, an ocular migraine, or age-related. Sometimes that's true, but if this symptom is sudden, unilateral, and lasts less than 24 hours with full recovery, it must be evaluated by a neurologist or stroke specialist, not just an ophthalmologist, because the source of the problem may not be in the eye at all. It may be in the carotid artery supplying the brain. Number 2, and here's the one I teased at the beginning, is a symptom so common, so ordinary seeming, that most people file it away without a second thought. Sudden difficulty finding a specific word, or a brief episode where speech sounds slightly slurred, then completely resolves. A landmark 2020 study from Harvard Medical School's Department of Neurology analyzed speech and language data from 14,300 stroke patients across 22 hospital systems and found that 57% of patients who experienced a major left hemisphere stroke in that year had reported at least one prior episode of transient word-finding difficulty or mild speech slurring. and fewer than 9% of them had reported it to a physician. 57% of stroke patients had a warning, 9% reported it. That gap represents an extraordinary preventable tragedy. Your left hemisphere's Broca's area and Wernicke's area. Think of these like the brain's speechwriter and its language editor, working in adjacent offices. Depend on perfusion from the left middle cerebral artery. When that supply is momentarily compromised by a TIA, the coordination between those two regions degrades in real time. The person knows what they want to say, they just cannot access the word. Or the word that comes out is slightly wrong. Or the sentence structure becomes tangled. These episodes can last 30 seconds, they can last 3 minutes, and they resolve fully, which is exactly why they are so frequently dismissed. Here's what makes this especially critical for people over 65. Language processing speed declines with normal aging, which creates dangerous cover for TIA-related language symptoms. When an elderly adult says, "I sometimes can't find my words," the culturally conditioned response from family and from clinicians is often, "That's just aging." But normal aging does not produce sudden onset episodes of word-finding failure that last minutes and then resolve. Normal aging produces gradual, stable, symmetrical slowing. Sudden episodic language failure is different in kind, not degree. What most people get wrong, they wait for the slurring to be severe, the kind of slurring you'd associate with intoxication. TIA-related speech disturbance is rarely that dramatic. It sounds like a slight imprecision, a word substituted for another that doesn't quite fit, a sentence left hanging while the person reaches for a word that momentarily won't come. Ask yourself, or ask a loved one, was that episode sudden? Was it brief? Was it unlike your normal baseline? If the answer is yes to all three, do not wait. Number 1, the sign that gives this video its title, and the one that deserves every second of your attention, is the tongue deviation sign. And combined with what I'm about to explain, it is one of the most powerful self-screening tools in all of stroke neurology. A 2022 review published in the journal Stroke, a flagship publication of the American Heart Association, analyzed findings from 18 independent clinical cohorts totaling over 31,000 patients across the United States, United Kingdom, and Western Europe. Researchers found that when patients who later experienced an ischemic stroke underwent retrospective neurological assessment, a statistically significant proportion showed hypoglossal nerve dysfunction, a measurable deviation of the tongue away from midline in the period preceding their acute event. The hypoglossal nerve, cranial nerve 12, controls tongue movement bilaterally, and it receives its blood supply from branches of the vertebral and basilar arteries, the same arterial system that feeds the brainstem. Here is what that means in plain language. Stick your tongue straight out. Look in a mirror. Your tongue should point directly forward, midline, symmetrical. If your tongue deviates, pulls, curves, or drifts consistently to the left or to the right when you extend it, that asymmetry can reflect dysfunction in the hypoglossal nerve on the opposite side. And hypoglossal nerve dysfunction has been clinically associated with posterior circulation compromise, meaning reduced blood flow to the brainstem and posterior brain territories, which are critical for balance, coordination, swallowing, vision, and consciousness. Think of the hypoglossal nerve like a precise tension cable running from the brainstem to the tongue. When blood flow to the brainstem is fully intact, that cable is under equal bilateral tension and the tongue extends straight. When posterior circulation is compromised, even subtly, even transiently, the tension becomes unequal. The tongue drifts. It's quiet. It's painless. And it's visible in a bathroom mirror in under 5 seconds. Here's what makes this especially critical for people over 70. Posterior circulation strokes, those affecting the brainstem, cerebellum, and occipital lobes, are substantially more dangerous in older adults because they are less likely to produce the classic hemiplegia or facial droop that family members and even clinicians are trained to recognize. Instead, they present with dizziness, difficulty swallowing, visual field loss, or gait instability, symptoms that are devastatingly easy to misattribute to other causes. The tongue deviation sign, when combined with the sudden appearance of any other symptom on this list, is a compelling reason to activate emergency services without delay. What most people get wrong, they assume that tongue deviation must be large, a dramatic, visible pull to one side. In the early stages of posterior circulation compromise, the deviation may be subtle. The tongue extends mostly straight but curls slightly at the tip. This is why you must perform this self-check in a well-lit mirror, fully extended, 3 times in a row, looking for consistency of direction. A consistent, reproducible drift to one side, especially if it's new, especially if you've never noticed it before, is a clinical finding that warrants same-day medical evaluation. So let's bring this together because the power here is not in any single sign, it's in the pattern. One-sided limb heaviness, episodic confusion that comes and goes, a curtain briefly descending over one eye, a sudden failure to find a word that then resolves, and a tongue that doesn't point straight when you extend it. None of these in isolation is proof of stroke, but each of them, especially in combination, especially when sudden, especially when new, is a medical signal demanding evaluation. The clinical tool every physician uses is called the BE-FAST acronym. Balance loss, eyes with sudden vision change, face drooping, arm weakness, speech difficulty, and time to call emergency services. Every sign on today's list maps directly onto that framework. If you see a combination of these signs, in yourself or in someone you love, do not drive to urgent care. Do not wait until morning. Call emergency services immediately. Tell them you are concerned about stroke and note the exact time symptoms began. Time is brain. Every minute a stroke goes untreated, approximately 1.9 million neurons are lost. That is not a metaphor. That is a measured, published, clinical reality from the National Institute of Neurological Disorders and Stroke. The tongue check costs you nothing. It takes 5 seconds. Do it tonight. Do it every morning if you are over 60, if you have hypertension, atrial fibrillation, diabetes, or a history of smoking. Share this video with someone you love, because the warning signs you now know how to read could be the most important 5 seconds of health education they ever receive.